Hey, what's happening? Right now, you are listening to the Victory Loves Company podcast. Today is Monday, April 30th, 2018. I'm Conrad Agdarian, and today I am joined by a very special guest, Dr. Jaime Bastidas, a board-certified plastic surgeon at the Chubak Medical Group. He specializes in office-based laser-assisted body sculpting. Utilizing modern and the latest technology, his approach does away with the need of lengthy hospitalization and general anesthesia. He prides himself on not making you look like someone else or never to transform you into someone your friends and family won't recognize, but rather than gently turn back the hands of time so they can see a more beautiful version of yourself. And as a personal outpatient of the doctor for almost a year now, God damn it, that's exactly what he did. So without further ado, I'd like to welcome the doctor to the show. Dr. Bastidas, welcome to the show.
Thank you. Thank you for having me.
My pleasure. That was quite an introduction. A lot of my guests don't like the big intros because it gives them something to build up to, but I feel like given your bedside manner and your ability to produce good results, I think you can handle it.
Oh, yeah. I have no problem with it.
So you are a board-certified plastic surgeon. Is that correct?
Correct.
And if I had to pick a theme song for you, I would do Jimi Hendrix If 6 Was 9, because you've been turning sixes into nines for quite some time. Doctor, why don't you tell us a little bit about your medical background, please?
Well, as you said, I'm a board-certified plastic surgeon. So why did I become that? Basically, it's something that runs in the family. My dad was a doctor. My mom's a dentist. I have 5 brothers. We all kind of went in that direction. Mm-hmm. So here I am in med school trying to decide what I want to do. I've always felt like I wanted to help people and use my hands and fix things. And to make a long story short, that just led me to plastics. Plastic surgery is everything that I enjoy doing. I'm doing patient care, I'm fixing things, I'm using my hands. It involves, I had an interest in engineering too, so it involves some of that as well. Mm-hmm. For the reconstructive work. And I always say that plastic surgery found me. It's just where my talents laid.
So this is an area that shows you didn't choose it type of situation?
Yeah, pretty much.
Yeah,
I was open-minded by it. Some people go into plastic surgery because that's what they want to do. Mm-hmm. But for me, it was more, I want to do something that fit me the best, and that's what it was.
Was there something that happened in your life or any kind of special occurrence that kind of triggered it? Say, you know what, this is kind of what I want to do, or this is my calling?
Yeah, there was a period where I didn't know what I wanted to do. When I was in med school, my third year in med school, we rotate. We go to the hospitals and we get our experience in all the different fields in medicine. Mm-hmm. And I'm thinking, hey, I'm going to be a surgeon. You know, I just love using my hands. I love this. And I do my surgical rotation, and it was miserable. I really didn't like it.
What didn't you like about it?
The environment. Okay. I'm a very positive person. I don't like malignant environments, and there was a lot of that. It was very stressful. And I'm thinking, God, do I want to do this? I want to, surround myself with all this. And my brother, for instance, he was a surgical resident at that point, older brother, and he would be at home. We'd be eating dinner at the table, and he'd be literally falling asleep while chewing his food. It was, I was like, God, do I want to do this? And the littlest thing, there was just, I just didn't, I don't know how to say this, but it was.
Your heart wasn't in it?
No, it wasn't that my heart wasn't in it. The environment was just, it wasn't good. Mm-hmm. I didn't know if I wanted to be in that.
And how old were you when you came to this realization?
Well, this is my third year in med school, so
okay.
So it'd be 3 years after college.
All right, so I had mentioned that you're board certified. What does board certified actually mean, and why is that a big plus in your industry?
Board certification kind of tells the public that the physician is first of all nationally recognized. The board is a national organization. There's a lot of standards for education, knowledge, experience, skills, and that's part of being board certified. And being board certified in plastics shows that dedication.
And credibility too, obviously.
Oh, yeah. Yeah.
Okay.
So there are some cosmetic surgeons, for instance, who are out there who say they're board certified. But in reality, they're not part of what we call the American Board of Medical Specialties, which sets the standards. And all the board certified doctors, depending on the board, I have to be part of that. So if you're part of an organization and you have your own little board, you could say, oh yeah, I'm board certified, but that's not the same. And that's what makes it credible. So being a board certified plastic surgeon means I'm part of the American Board of Medical Specialties, which maintains a very high standard.
How long did it take you to prep for that, if you don't mind me asking?
Oh, yeah, that's a good question. It took a while.
I would imagine so.
So, first of all, you have to complete your residency. Residency is the training you have after med school. So you do your 4 years of med school, you apply for residency, you get training, whatever it is. And for plastics, you need to have surgical training first before you do plastic surgery residency. So it's 2 residencies.
Okay.
So typically, a lot of plastic surgeons do 5 years of general surgery, then they go off and do their residency, and it's another couple of years. Then that's not it. It's not like you finish residency and you take your board. No. And then you have to be in practice a while. You have to build up a case log. And
how long does that typically take?
You need a good year. You need a good year of cases. And then you have to submit that to the board saying, these are the cases. Am I eligible to take the board? And they look at it and said, no, you didn't do enough of this, or you didn't, no, you're not getting enough experience, or you can't do that. So you have to submit that. Once they accept that, then you have to take the board exam, which is in 2 parts, a written exam and an oral exam. So the written exam is hard-ass exam.
I would imagine so. Yeah.
But the real hard part to me was the orals, because here you go to, this was in Phoenix, Arizona. We all get together there, and we have the best people giving these exams, and they're hitting you with questions. And you also have to submit cases for the board that they go over with you as well. They select 5 cases from the whole case log, so you have to prepare a whole book on these things, everything, every last little detail about it, and they'll grill you on it.
How many case logs did you have when you went in?
Oh, it was 5 for me. But
okay.
I mean, the number of cases, I don't remember how many I submitted. It was a lot.
No, what I'm saying is, did you log like 17 and they only choose 5?
No, they go over the entire list and they say,
okay,
we want you to present these cases.
That's going to be nerve-wracking.
Oh, yeah.
You know,
oh, yeah.
Probably a lot of sleepless nights there.
I remember one guy, who was talking about, I forget where he was from, but he was once in he was trying to remember, I don't remember, but he was in a situation where it wasn't in the States. He had to evacuate his country. There was gunfire. He was like, he's a refugee. And he said taking the board exam was scarier than that. Oh, wow. I was like, oh, wow.
Scarier than living in your own country.
Oh, no. It was quite an experience. So going through that, it's just pure dedication. So anyone who's willing and does that whole process is dedicated. Mm-hmm. And that separates you from the other people who just decide, oh, I want to do cosmetics and take some weekend course and get their little certification that they can do this little procedure and start doing it. Big difference.
Coming out the other side of this knowledge that you obtained from this, what did you learn about yourself personally going through that vigorous process?
What did I learn about myself?
Did you realize that you were better performing under pressure? Did you realize you weren't performing better under pressure? Did you realize you sucked at public speaking? Things like that.
Well, anytime you're faced with a challenge, it makes you recognize what your strengths are and what your weaknesses are, mm-hmm. and helps you. Basically, for me, speaking, presenting the case, answering the questions, that took work. I took courses to help with that because it wasn't my strong point, and that was tremendous. Doing things like that. But any challenge, I think.
Anything worth doing is worth doing, right?
Exactly.
I agree. Well, good. Well, again, congrats on everything. I mean, you seem to be doing very well.
Yeah.
You got a great staff here. You were always nice to me. And you got a great bedside manner, which I don't know if they taught you or not.
Well, thank you.
But that came naturally to you. So, Doctor, what areas do you specialize in? I came in almost a year ago to deal with laser removal, which is probably a small percentage of what you do. But just generally speaking, what are some areas that you specialize in?
Well, let me ask you a question. What do you think a plastic surgeon does?
Oh, Jesus. Immediately I think of Beverly Hills.
Exactly.
But there's cosmetic for enhancing, and then there's cosmetic for fixing, i.e. you were in a car accident and your nose or your chin or something is disformed, and maybe that's where a plastic surgeon wants to could step in. Again, the flip side to that coin, you got somebody out in Beverly Hills, a woman wants larger breasts, they want lips like Angelina Jolie, and I guess that would be what would be considered a pleasant problem or something. So for more of a cosmetic procedure. But that's what I think of. But I do realize that your reach is much farther than that. Probably just given my limited.
And what you describe is exactly what most people think of when you say plastic surgeon. You think cosmetic surgeon. That's just an automatic thing. I don't know how many times people, when I'm talking to them, say, "Oh yeah, I had to go to the ER last night. I had an emergency," and they laugh and say, "Well, you had an emergency breast augmentation,"
right.
Things like that. And the thing is, there's a lot more to plastics than the cosmetics. So we have, we do reconstructive work. We do craniomaxillofacial work. That's like the head and face and things like that for deformities and things like that. Hand surgery, microsurgery, and then we have all the aesthetic stuff. So there's a lot to it. And in the beginning, I was a general plastic surgeon, did it all. And through the years, you learn about things that you like, learn about things you don't like, and you just find your path, and you become more focused. Because I don't think, especially these days, there's no need for generalists. It's not like we're out in some back country where I have to handle everything. So I think it's better to focus on, things that you enjoy, things that you think you're good at, and becoming an expert on that. And that's what led me to here with Chubak Medical. Dr. Chubak is a phenomenal vein specialist, and his practice is office-based. So we're looking to do the equivalent thing for services I can offer, keeping things in office and making the patient experience phenomenal, as best as we can make it. The main reason I became a doctor was to help people, plain and simple. And it's hard to do that in the medical culture right now when it comes to insurance, hospitals. There are a lot of things, and it kind of takes away from being a doctor.
Have you found that that's been more complicated in recent years?
Yes,
okay.
I think it has gotten. I'll just say I don't want to say anything bad, but yes, it has become worse.
You can say it. I've said a lot of bad things on this podcast. It's okay. I'd rather you be honest about it.
Yeah.
I got you.
And I don't want to become a slave to insurance or a slave to this. I want to treat patients the way I do, just the way I want to. And that means having a conversation with them, being able to talk to them, like our little discussion here. I wouldn't be able to do this if I were a hospital employee. I'd be running my ass off. Plain and simple.
A lot of red tape associated with
exactly.
that. Exactly.
Being office-based, having that luxury of talking to our patient, getting to know them, finding out what they want, I think that's key. My dad told me, I remember this as a kid, he goes, 90% of the time you can figure out what to do for a patient just by talking with them. The exam and everything else, the testing, just confirms what you think is necessary. And to me, that's key, and that's very important.
Well, also you have the luxury of getting to know your patients, on a personal level, obviously.
Yeah.
I mean, most doctors do, but you have your reputation behind you, and you also have the luxury of building trust, not just so much a relationship, but trust, I feel, is a key ingredient here, because you get somebody like myself. I was referred to you by someone else who came in here and had something similar. They were referred to you by somebody else, so it kind of snowballed into this this referral system you got going. And as a business owner myself, I understand the power of referrals. Yes. Because it shows that someone likes you so much that not only are they going to spend a considerable amount of money with you, but they're going to also go ahead and do what is a potentially permanent procedure on them, even on their face. So that's a lot of weight to carry on your shoulders. But as I mentioned in my intro, I think you do a great job. Every time I've come in here, I've had nothing but a pleasurable experience. With the exception of the laser. But,
yeah.
But, pain is beauty and beauty is pain, right?
Exactly.
The old saying is. Yeah, I agree. With the hospital thing, it's a little more interpersonal.
Yeah, it's a shame what's happening. And I do want that interaction. I do want to develop that rapport. I think it's really important to know the patient. And, I always say patients don't read the textbooks. You have to get to know them, because one thing can hurt, and one patient and the other patient, you do the same exact thing and be totally different. It's there's a lot of variability, and it's important.
You had mentioned earlier that when you first started out, you were kind of a jack of all trades and
yes,
kind of really a master of none. But as you've grown into yourself, you realize what you like and what you don't like. The way it stands now, what is the most common procedure that you have done? And how has that changed in the past 10, 15 years, if at all?
Well, right now, since the focus was office-based, we looked to see what we could do in the office. And the most common procedure I'm doing right now is body contouring.
What does that mean exactly?
Changing the shape of the body. And we do most of the office-based stuff that we do here is smart lipo, or laser-assisted liposuction.
Okay.
And it's done totally under local anesthetic. So patients awake, and I shape their body, and I can talk to them. I can interact with them.
Nice.
And the patients love it because they're not going to a hospital or surgery center. They're not getting anesthesia. They're
not getting knocked out. Yeah.
Things like that.
Yeah.
And for me, there aren't too many plastic surgeons who do that. There are other cosmetic surgeons or providers who do office-based procedures. But the main reason they do it is because they can't go to a surgery center.
Right.
They don't have those privileges. But for me, I said, hey, if we can do a good job under local, why not offer that service? I can still take them to a surgery center. If they want to be out, I can do it and knock them out. But it's the most common thing I do here. The other thing is we're expanding to other procedures as well. One of the big things I'm starting with now is hair transplantation. Now it's a focus, because that's a procedure we can do strictly under local. Patients awake. It's a nice process. They come in, we start off the whole thing. I'm not going to get too much into hair transplant, but the morning is preparing, then give them a nice little break for lunch, and the afternoon is putting the hairs where we want them. And
is that a single day procedure?
Yeah, I mean everyone's different. Again, everyone you have to make the proper plan, and it's not uncommon for people to get more than one procedure to get the final result. But it is any hairs we transplant and anything we plan out done that day.
Is that permanent?
Yes,
So why would somebody need to go multiple times then?
Well, it's permanent in the sense that the hairs that we move are permanent, but we're not creating hairs. We're not. We're taking existing hairs and rearranging them.
Okay.
Okay. So we have to make the most of the existing hairs.
So you're taking it from point B and putting it in point A where they want it.
And there is also a limited amount of hairs we can take at a time. So sometimes you might need to take more hairs than you can in one shot.
Okay.
So you might do repeated sessions like that.
Okay.
Also, depends on the age of the patient and progression of their hair loss. So maybe 10 years down the road, there'll be an area that was not as obvious as it was when they first had their hair transplant. And they'll say, I need to fill this in again, so we can do some more.
So a 40-year-old would be easier to work on than a 55-year-old?
Well, actually, no. I think that the more challenging person is more the 20-year-old who's losing hair, or the 30-year-old, because they can progress a lot. So,
all right.
So you have to take that into account. Once you're 40 or 50, I mean, you may have some progression, but you're more stable. And I'd be less hesitant to do a hair transplant on an older person than a younger person.
Really? That's interesting. I would never thought that. But
Yeah.
that is a good point about the 20-year-old.
Yeah.
You try to do office-based
Yes.
procedures. Do you find that that's more of a growing trend, that these type of procedures are performed as an outpatient and not so much in a hospital? Has that changed recently?
I don't think so. Or
was it always like that?
I think it's always like that. It's because there are plenty of people who, I'm not the first person to do office-based procedures. There's a long history to it.
Right.
But I think there are more people who would rather do procedures where they don't need anesthesia than there are people who are willing to get knocked out.
I'll throw my hat into that, right?
Yeah, exactly. So there's all these people out there who's like, I wish I could get that done, but I don't want an IV, or I don't want to be knocked out, or I'm worried about this. We can offer it now. And we're opening doors to more people. I think that's what that's all about. And yet, I can still do the traditional liposuction with sedation or anesthesia, or I can even do full body makeovers like the mommy makeover, which requires general surgery. General anesthesia.
Unbiased answer. Do you produce better results as an office-based outpatient or in a hospital? Or is that kind of a loaded question as well?
No. Actually, it's a great question, because I think I can get better body contouring results with the lipo under local than I do when the patient's knocked out. I can't do as much. When the patient's knocked out, I can cover more areas, so there's that advantage of being knocked out. However, when the patient's awake, and this is one of the things I discovered only by doing it, I didn't know this ahead of time. Sometimes, imagine, I don't know what you look like standing up versus laying down, but most people, when they're standing, look different than when you lay down. Because gravity
or sitting.
So the body position makes a difference. So if you're examining someone standing up and you're going to be doing, say, their belly or their flanks that they don't like. When they lay down, they automatically look better. The things change.
I agree. Yep.
So by having them awake, I can actually ask them to do things like tighten your stomach muscles or turn your body this way or do this. I can't do that when they're asleep. So they can actually help during the procedure, and I think I can get better results like that.
Well, it goes back to your father's philosophy. You can figure out 90% by just talking slow.
Exactly.
You can't extract that when they're under, right?
Yeah, it's true.
All right.
And with them awake, it's an added benefit, which I didn't realize until doing that. The other thing that I also found that's very helpful that we discovered, well, not discovered, but we implemented doing office-based procedures was using ultrasound technology. Ultrasound technology to assist with procedures is there's a long history to that as well. But we never train or use it with liposuction.
Okay.
Now, one of the things I learned about doing office-based liposuction was there's a technique of putting the tumescent or the numbing medicine inside the body. With the patient awake, that can be a challenging treatment because you don't want to hurt the patient. Then we found if we use ultrasound, we can use the ultrasound to see exactly where we're putting fluid. We can put it in an area that is the least painful and make the overall patient experience good. In fact, we just wrote a paper on it, and we're publishing that because it's a big help. And it's exciting. Change things for other reasons, not related to this. I'm discovering new things that I really like, and it's pretty cool.
What are some examples of goals your patients try to achieve by way of cosmetic surgery? Like, what would somebody's goal typically be?
Well, bottom line, they just want to look and feel better about themselves. I mean, for me, if I'm going to be helping someone with an elective cosmetic thing, I want to make sure they're doing it for themselves. Not that, oh, my husband wants me to do this or my wife wants me to, have this done. That's not a reason. That's not a good reason. The person having it done wants to feel better about themselves. In the beginning, especially when I was in med school and residency, I was like, cosmetic elective. I mean, I had some questions like, why would you do that? Mm-hmm. But after having done procedures and experienced it, and like in med school and residency, I see the benefits. It really, it doesn't make. Initially doesn't make sense. Like when someone cuts their hand and you stitch them up, that's a no-brainer. Right. I mean, they're open wound, you fix it. So you're taking someone that has no cuts or anything, and then you're cutting into them and changing things. And wow, is that right? But it's we're human beings. Why do we cut our hair? Why do we wear nice clothes? Why do we wear jewelry? Why do we do these things? Our brains just function that way.
To feel better about yourself.
Exactly, you feel better. And there's a part of you that you don't like, and you can change and make it better.
And you have the means to do it, why not? Yeah.
And I've seen transformations in people, which would blow me away in terms of attitude, energy, just overall happiness. And
because they have their self-confidence.
Exactly. And that's just the way we are. That's the way we are people.
It's one of the perks of your job, right? You get the before and after, and you get to see people.
Oh, yeah. Because I got that when helping someone, like, I was just in the ER the other day, and I put someone's thumb back together. It's a great feeling, and they're happy. But we get the same things with these cosmetic things. But at the same time, to me, they have to be real things. There are people out there who want things done I don't think you should do anything for. It's getting to know the patient, understanding what they want, and saying like, oh yeah, I could see that, and I can give them that. It's a no-brainer at that point.
Let me ask you something. Have you, people that come in here or come in to see you are doing X, Y, and Z for themselves so that they can, for one way or another, feel better about themselves, look good, feel good, whatever. Have you ever had somebody come in here that is getting something done for someone else rather than themselves? Hopefully I worded that correctly.
Yeah, I understand.
Let me give you an example. I forgot where I read this, and I thought this was downright hilarious, yet it was wishful thinking. There was a woman, it was on, I guess it could have been on reality TV for all I don't know. The woman got breast enhancements, implants, as a Valentine's Day gift for her husband. And I'm like, holy shit, I want that for Valentine's Day. it's a joke. I'm happy exactly where she is. But have you ever had anybody come in here that got something done for somebody else? Like, I don't want to use fat shaming, but maybe a husband that's not satisfied with the way the woman looks.
I do see that when they come together, and I hear the partner speaking more for the patient and saying things like stuff like that. I'm not comfortable with that. Again, because
I wouldn't be either.
No, and it's one thing in the cosmetic world, and actually with any patient, if you're going to be doing any treatment, you have to understand their rationale for doing what they're having done. I mean, especially if it's not for a medical reason, and if it's not for themselves. Bottom line, then right there, it's kind of a red flag.
To me, that's a symptom of a bigger problem, though.
Yeah.
Why are you with the person if they're not going to love you for who they are? I mean, I know that's kind of a cliche thing to say, but it's the truth of the matter.
True.
People are going to lose weight, they're going to gain weight,
yeah.
They're going to get wrinkles, they're going to get gray hair, and I mean, that going into it. And if you're not going to accept that for who they are, then why'd you get married in the first place? You know what I mean? And I don't know, that's just me speaking.
No, we're getting into some pretty deep stuff there.
Yeah, it's a psychological aspect of what you do. Yeah.
Exactly. So. And this shouldn't be done to salvage a relationship or make someone.
If it is, that's very sad.
It is very sad.
Yeah, yes. And feelings of resentment, especially from the woman's standpoint, like, oh, he made me do this.
Exactly.
Whatever. It's just a symptom of a bigger problem.
Now, if the woman's doing it for herself, like breast augmentation, for instance, if she's doing it for herself and she knows her husband's going to love it, then it's a win-win,
What are some options that are available if people are dissatisfied, which is, I guess, inevitable, right?
Mm-hmm. In terms of their body or
respond instinctively.
Okay, well, there are lots of options.
Most common. How about that?
Most common.
Yeah. What's the most common option if somebody is dissatisfied by the way something came out or turned out?
Okay. Well, if I break it up into a couple things. One, a lot of people look at their face and they want to know, what can we do for our face? And the face typically with time changes. Call it the 3Ds. There's deterioration of the skin, there's descent of the tissues, and there's deflation, meaning areas can get hollowed out, cheeks get hollowed, temples, things like that. Mm-hmm. So we combat those things. And the treatment for those three things there's never one simple treatment. It's multiple things. So you have to attack all these things. So we do things that treat skin. So there are laser treatments. There are facials and things like that. There's energy to put into the skin to try to tighten it up. And these are all non-surgical treatments. Then we got minimally invasive treatments, which are through small incisions, we do things under the skin to help improve it. And then there's full-fledged surgery where the classic nip tuck. Right. And that can be that approach can be taken for anything, any part of the body. So if I'm doing body contouring, I have non-surgical treatments, I have minimally invasive treatments, and then the full surgical treatments. Mm-hmm. And being a board-certified plastic surgeon, I think it's important for people to see that if they're going for any type of treatment, that the provider, the doctor, or the surgeon is board-certified and shows that. Makes a difference. That doesn't mean every board-certified plastic surgeon is going to do a perfect job. Right. I mean, we're human. We're all different. So, but that's one important thing I think people should know. You got to be very wary of cosmetic surgeons because there are plenty out there who say they're cosmetic surgeons and they portray themselves very well, but they aren't trained. And I've seen too many botch jobs from people who have gone to these cosmetic surgeons.
That's got to be a nightmare.
No, it is. Yeah. It is. It's sad, actually. Mm-hmm. So be very wary. Just out there, providing good service is key. So that's one thing I want to make sure everyone is really wary, because I've seen too many people go out of the country or just find someone who's cheap. And I've seen
price shopping. I think is the worst thing that you can do.
Oh yeah, absolutely.
Like I would never buy condoms from the dollar store. that is one area of your life you do not want to skimp out on, and that certainly applies to your area of expertise. Pay a little extra. You want to find somebody that's reputable, somebody that's easy to get a hold of. Sometimes doctors aren't exactly the easiest to get a hold of, and someone that knows what they're doing. And the bedside manner is a bonus. And as I said earlier, you got the trifecta there, doctor. You got it all. So, what percentage would you say out of what you do here in the office is dedicated to laser hair removal.
Right now, it's actually a smaller percentage. When I first started here, it was high because it was I had to develop a reputation. So we had to offer something that was simple, straightforward, predictable, and that was one of the services. So I had a lot of people coming in for that, and they get to know me. Then they find out, oh, you can do this, you can do that, and we're building up providing more services. And then, for me, I am a surgeon, so if I can do something surgical, that's what I prefer to do. And now that people are getting to know me and coming more, I'll be honest, I'm doing less laser hair. I still offer it because if you want it, I'll help you out.
Is there a certification for that? Or what you do is that kind of like the umbrella of everything that you do?
In New Jersey, there are very strict laser laws.
Okay.
So, people have to have a certain amount of training. Like in New Jersey, physicians, you have to be a physician, or I believe PAs now, physician assistants who go through their own training can do that. But there are states where, if you're an esthetician or you take a course and everything, then you can get certified and do laser treatments. But in New Jersey, it's definitely more strict.
What percentage would you say are men? What percentage are women?
I'd say right now I'm seeing about maybe 20. Well, it depends. For laser hair, I'd say about 80% women.
Really?
Yeah, a lot.
Has that number changed since, manscaping and being a metrosexual on the male side is kind of like on the rise? Because I can remember a time when, men were not featured in any type of beauty commercial. Or any kind of cleaning commercial for that matter, if you want to talk about being progressive. Now that's starting to kind of shift a little bit. Men are more into beauty products and making themselves a little more well-groomed and whatnot.
Definitely seeing more men now.
Okay.
Definitely seeing more men.
What is the most common area that males get done?
Usually the body.
Chest,
belly, back, things like that. But I do get around the beard as well. I don't see much in terms of legs or arms with guys.
Yeah, that would make sense.
Yeah.
What about women?
Women,
the opposite, legs and arms?
Almost every part of their body. Face, underarms, chest, belly if they have it, and the bikini area and things like that.
Oh, that's good.
Oh, and legs, of course.
Any men get their genitals done?
Men and women, yeah.
Oh, Jesus.
Yeah.
Oh,
yeah.
No.
But since I've been here, and it's been a few years, I haven't had any guys come in for that.
Well, I'm not going to be your first because...
Thank you.
All right, Doc, just kind of rounding the corner here. I think we touched upon most, if not everything, that I wanted to discuss here. Is there anything else that you would like to add? Do you have any advice for people out there that maybe you're kind of a little leery about taking the first step about getting any kind of cosmetic procedure done?
Well, I got a couple things. One, if you're going out to see someone, it's important that you see someone that you're comfortable with. I try to connect with everyone, but I'm not going to connect with everyone. I think developing that rapport when you go to see someone, again, don't price shop. Don't go to them because of what their website says or whatever. Go to them. I mean, if they have a great website and you go see them, great.
Right.
But the person is the key thing, that connection.
No,
if
I
you're
agree.
not comfortable with who you're with, even if they have a great reputation and do great work, don't do it because you need that. You need that connection. I think that's key. So that's one thing. Connect with that. And again, we mentioned the price shopping thing. Also, make sure that they're certified, that they've done the proper training. That's very important, and experience.
All right, Doc, I think that should do it for here. So again, thank you for coming on the show.
Okay, great.
All right.
I had a good time.
All right, everyone, that should kind of do it for now. Thank you for listening to the Victory Loves Company podcast. I'm Conrad Agdirian. And as always, if you have any questions or any suggestions for upcoming shows, please email us at thevictorypodcast@gmail.com, as well as check us out on our social media handles at VLC Podcast. And I'll talk at you next week.